Good afternoon, ma'am. How are you?
I'm good, thank you. How are you?
I'm doing good. Can you tell us more about yourself?
My name is Olive and I am a youth advocate at the Generational Stewards for Antimicrobials. So we are the young advocates who work towards creating stewardships for antimicrobial use and also just to encourage the public on proper use of antibiotics.
Thank you so much, ma'am. So what were you doing at High Foods and at Mare during this World Antimicrobial Resistance Awareness Week?
Yeah, so from the 18th to the 24th of November, it was the World Antimicrobial Resistance Awareness Week, and we as the Generational Stewards for Antimicrobials, as young people, youth advocates, vibrant, we were going through the different communities and streets of Harare. We were with Machipisa, we were in Highfield, and we came to Mbare, and we were doing awareness initiatives of antimicrobial resistance. So we're doing one-to-one conversations with the community, understanding what their deficiencies are, understanding what their challenges are in actually using antibiotics correctly. And also us as the Generational Stewards for Antimicrobials, we're also spreading the message to people for them to be able to use antibiotics correctly, and also what this issue of AMR is even to the public.
Thank you so much. So what are some of the perceived behaviors that you saw when you were doing this campaign in the different communities?
Yeah, so when we were having these one-to-one discussions with people, we identified that antimicrobial resistance is actually more than a scientific problem at hand. We have different social challenges that are going to hinder our progress if we are going to talk about antimicrobial resistance. We've got economic challenges that come into play. We've got social challenges that come into play. For instance, we had a man who outwardly or loudly said that they cannot go to the hospital to pay for consultation, which is about $5. Rather, they can go and buy amoxicillin for about $1 and it's cheaper for them.
Kuti sisi yatotorera amoxicillin tichimwa tisina kuenda kuona chiremba inyange tangozvirapa pasta totopora toenda kubasa tikaenda kuchipatara kwacho makliniki ehurumende aya tosvika tonzi consultation fee $15 asi handina kana chandiri kupuwa vadya mari yangu kana parasetamo kana riya rimwe rinobatsira reedzi riya hatiri puwi saka ivo pachavo kana da tisatore iri amoxicillin ngavangotirapa waisa kuchipatara mishonga inotenda kuti isusu flu ipere pane kuti isusu titambure tatiri kuita izvi saka ndoritenga kuMbare kuno kana murodhi ngomwa amoxicillin saka ndotokumbira kuti imimi muende kunovaudza kumberi kuti vanzi nesu kunoko udzai vanhu vose kwete kudzai isusu kuno kuMbare endai Zimbabwe yose amoxicillin ndoratwa pamberi kutorapa isusu flu
Buya vangu wakangonzwa fulo kuti
amoxicillin.
Hey mwana wangu.
Chicha ndiro ndinandapa. Musoro kutema amoxicillin nepower. Ndozvega zvatikuda. Saka imi mungakwanisa kuita zvinhu izvozvo matibatsira. Hurumende ngaitibvisire $5 consultation fee. Tisati kubatsira kumakliniki. Ngavatipe mushonga chaiwo tobhadhira $5. Vakasadaro pamberi neamoxicillin.
And if you're hearing it from a community person's perspective, that makes sense because no one would want to spend more money when they can get the same service for lesser money. So those are some of the challenges that people then go through because they cannot spend more when they can have antibiotics for less.
So what are the proposed solutions that you can share with healthcare professionals, healthcare supply chain systems managers, and all those who are in decision-making corridors?
Yeah, I do believe that AMR is a huge problem, and not only one sector or only one person will be able to conquer it. It's going to need collective action from all different sectors. It's going to need a collective action from health professionals. Currently, we see that there isn't that agreement or there isn't that working together with health professionals, those who are nursing, our clinicians, our scientists, our pharmacists, people who are supposed to be working together. There is that disintegration. And also even with the community, being able to communicate with them and educate them properly what's supposed to be done. So I think this needs collective action for us to find solutions that actually matter today and solutions that are practical to people, because it's one thing to tell a person to stop using antibiotics, to stop getting antibiotics for $1 and buy antibiotics for $5 from the pharmacy when it's not practical. At the end of the day, what we're doing is just throwing away words and just doing things that are not actually relevant and implementable. So I think it then needs a collective action from everyone at hand to make sure that we have practical solutions to fight antimicrobial resistance.
Okay, so do you have any words for the youth that are intending to fight this threat of antimicrobial resistance? Maybe
Yes.
you can tell us a word of motivation or encouragement so that they continue with the work or do it better in a way that is sustainable and also effective in their immediate communities.
True. So what I would just want to say to young people is we are the people. We are the generation, and we are the ones who are going to be there in the future. So whatever decisions we make today, whatever things we involve ourselves in today is what is going to affect us in the future, because it's us who are going to be in the future. So we need to be the ones who gatekeep these antibiotics. We need to be the ones who gatekeep our healthcare to make sure that we have a good, proper healthcare system, a good healthcare even for the future, for our children and for the future generations to come. So it is our responsibility to be stewards for proper antibiotic use, to be stewards to communicate even the antibiotic proper use to older generations. So I'll just say to young people, use that energy, not just for any other things, but use the energy to make sure that you're improving your healthcare system and your future.